Hi everyone, my name is Hanna Smith and I'm going to do Chapter 12, Autism Spectrum Disorder. The learning objectives that we're going to learn throughout my PowerPoint are identifying what autism is, learn facts about autism spectrum disorder, or what is also known as ASD, ASD diagnosis criteria change, how and when a child can receive a diagnosis of ASD, rating scales for ASD, how to capitalize on a student's strength with ASD, importance of evaluating and monitoring the student's preferences, strengths, and educational objectives, the importance of collaboration with special education teachers, paraeducator, and speech pathologists while using the IEP, classroom adaptations, educating the ASD student on communication and social skills, and safety. What is autism? Autism is a neurodevelopmental disability that significantly affects verbal communication, nonverbal communication, and social interaction that affects a child's educational performance. History. In 1990, autism began its own category within special education when PL 101-476 was passed and amended into the original Education for All Handicapped Children Act. Is autism on the rise? Medical professionals and researchers state that autism is not actually rising because we are better prepared to identify and diagnose autism. The American Academy of Pediatrics recommends all children be screened for developmental delays at regular checkups, which are at 9 months, 18 months, 24 months, and 30 months. According to the Center of Disease Control, 49% of children with an ASD diagnosis were first evaluated by the age of 36 months. Some believe statistics may be altered due to females being harder to diagnose. Females often have fewer repetitive and restrictive behaviors. In 2021, the meta-analysis found that females on average are evaluated for ASD 2 years later than males are. Facts about autism spectrum disorder. Autism is a lifelong disability where there is no cure. Currently, the rate for autism in the United States is estimated to be 1 in 68 children. Boys are 4 times more likely to have autism than girls. Symptoms are individually determined since autism represents a very diverse population. Continued facts. Characteristics of autism include delay in language, including the lack of speech, lack of initiation of conversations, where they feel more comfortable talking to the paraprofessional instead of the student next to them, for example, the repetitive use of language, lack of reciprocal social interactions. They don't know how to interact because they haven't been taught, and I will later discuss this in my presentation. Lack of eye contact and facial expressions, and body posturing. Diagnosis criteria for ASD. The criteria for ASD diagnosis was revised by the Diagnostic and Statistical Manual of Mental Disorders to help make the diagnosis of ASD more reliable. Previous and current criteria for ASD diagnosis. The previous criteria is there were 4 main disorders grouped under the category of persuasive developmental disorder. They're autism and Asperger disorder, which that is a developmental disorder affecting ability to socialize and communicate. Asperger children typically don't show delay in their language and cognitive development. The childhood disintegrative disorder, which is children develop normally through the ages of 3 and 4, and then they start to lose language, motor, social, and other skills that they have already learned. And Rett's disorder. Rett's disorder is a neurodevelopmental disorder characterized by typical early growth and development, followed by slowing of development. The loss of functional use of hands, slowed brain, head growth, problems with walking, seizures, and intellectual disability. This disorder is no longer in the autism spectrum. Today, the criteria is ASD is one singular diagnostic category. New definition of ASD. ASD recognizes there is a continuum on which the degree of symptoms will vary by individual. Symptoms such as communication delays and prolonged behavior must also be present in childhood to meet the new criteria for diagnosis. How to receive the diagnosis of ASD. The student must demonstrate deficits of social interaction and communication. The student demonstrates restrictive and repetitive patterns of behavior since early childhood. However, deficits may not appear until later when social demands are increased. At my daughter's dance lesson, there were two moms talking about their autistic children and how hard it was to actually diagnose them through the school system. Their children didn't initially meet the criteria for autism when it was done in the school, so they actually had to go to an outside resource to get them officially diagnosed. What causes ASD? What we currently know. Families do not cause ASD, and vaccines do not cause ASD. Family medical history may play a role. There is a 10 to 20 times higher probability that a sibling might also be diagnosed with autism. Most ASD children do not have a medical or genetic condition that can explain why. There are specific differences in brain function between a child on the autism spectrum and a child that is not. Some examples of these might be lacking the ability to reciprocate during a social interaction, lacking the ability to share or have joint attention, or lacking the ability to use physical cues such as eye contact or physical gestures, restrictive and repetitive behaviors such as tapping on a desk or rocking in motion or a repetitive leg movement, staying fixated on one topic for long periods of time, and inflexibility with changes in a routine or any new transition. Who can diagnose ASD? A pediatrician, a physician, or a professional experienced with using diagnostic instruments and diagnostic tools created specifically for ASD patients. These tools are Autism Diagnostic Observation Schedule and Autism Diagnostic Interview Revised. Teachers can complete a rating scale if they suspect a student is autistic. The Childhood Autism Rating Scale is a 15-item behavior scale. It is one of the first developed to screen ASD. The Gilliam Autism Rating Scale is a 56 items that closely match DSM-5 for the diagnostic category arranged in 6 categories. These 6 categories are restrictive, repetitive behaviors, social interaction, social communication, emotional responses, cognitive style, and the inability to adjust speech to the environment or the situation. Teacher alert, the psychoeducational profile is designed to identify strengths and weaknesses and skills in students with ASD. This will be helpful in your educational planning. The psychoeducational profile has 2 parts. The first part is a caregiver report. This is where caregivers identify areas of deficiency and a degree to which it interferes with the child's development. Part 2 is a performance profile that has 10 subtests. 6 of them measure developmental abilities and 4 are focused on behaviors not accepted in the classroom. An educator can also purchase a test kit with all of the materials needed to administer the performance measures. This test administrator can score either as a failing, emerging, or passing, which leads me to my next slide. Collaboration amongst professionals. A general educator should collaborate and consult with a special education teacher, such as a paraprofessional or a paraeducator, to modify curriculum to meet the needs of a student with ASD. An IEP should be initiated to develop an individualized educational program to help the student be successful. You can use this in your future classroom. The IEP will assist in getting the maximum learning experience for the student with ASD. Proper evaluation, monitoring, and evaluation with any changes will allow the student to be where he or she can best learn, and there will be no delays in the education. A speech pathologist may be consulted also for a student with some form of communication impairment or nonverbal. Classroom adaptations. ASD students need a schedule of daily activities. Some suggestions may be use of a daily planner, list of written activities or symbols taped to their desk. Using a visual timer will help to time any activity so they know when an activity begins and ends. Having a predictable schedule with easy transitions will help reduce stress or any unexpected behaviors. Classroom adaptations continued. An ASD students like to work alone but need the challenge of working in a group. An example of this could be a teacher would give a student a defined role first by looking up information and then taking the student off to the side and explain how to be a part of the group away from their peers, and then have the student join the group so they can hopefully actively participate. Another example of having a classroom adaptation for an ASD student may be the classroom can be distracting with too much on the walls for an ASD student. For example, an ASD student may become focused on a certain animal if the alphabet is represented by animals in the classroom. The student may stay focused on their favorite animal and doesn't continue the rest of the alphabet. Task design and task delivery. Task design is the objective of the lesson, so what is expected from the learner and what determines success of what is learned. Task delivery is how well the lesson is presented and how did the student respond to the instruction. Rules. Students with ASD like to follow rules because this provides structure and guides actions. It is difficult for them if things need to change, so giving them visual cues and time to process the change will help them adjust. Oral instructions may need to be given instead of words spoken. A student also may need visual picture cues from a book if nonverbal. A teacher may need to read test exam questions so a student can understand the meaning of the question better, and these are important for teaching ASD students. The value of communication. ASD students may need to be taught how to communicate so they can meet their own needs and wants. The picture exchange communication system will help nonverbal children identify what they want by using the picture and not acting out. Give extra time for ASD students to initiate and respond to each other. And ASD students learn by imitation. Seeing another student in class raise their hand to ask or answer a question is teaching them nonverbal skills. ASD students who can speak clearly with a good vocabulary still need to practice with initiating conversation, speaking in sentences, staying on topic, and starting and ending social interactions properly. Video modeling, where a student is videotaping themselves and then watching it to evaluate and learn what to do socially, is another good example of what an ASD student can do. Why are social skills important? Social skills are needed for successful functioning at home, school, and the community. Peers can be a great help with the development of social skills. Learning how to greet others, respond to others, and how to ask for help is important. Social competence is using these social skills in a meaningful environment. Structures and strategies must be put into place to promote peer interactions. If this isn't done, the ASD student could remain silent or only interact with adults around them instead of students. Classroom seating is important because it provides structure for task completion and peer interaction. Learning a social script for the ASD can be as them to watch others in a social context, learn how to say hello and goodbye, when to enter and exit a conversation, look at written or pictures with social cues in it and practice it. Once these skills are learned, the ASD student needs to interact regularly with many students, just not one. Otherwise, the skill will be used on one person only. The more you use it, the better it is. Safety. ASD students are at a higher risk for accidental injuries and drowning. This population has a higher rate for accidental deaths and notability lower life expectancy. The mean age at death for individuals with autism is about half that of the general population, which the age is 36.2. It is recommended that the autistic children's parents register them for swimming lessons to teach safety near water, since there is a high risk for drowning with this group. Around 28% of children with autism exhibit self-injurious behaviors such as head banging, hair pulling, arm biting, eye poking, and skin scratching. These kinds of injuries can lead to health consequences. I just wanted to let everyone know that Autism Acceptance Month is in April. This aims to celebrate and promote acceptance for the condition that occurs 1 in every 68 children in the United States. My niece was diagnosed with autism, and she is the most special, fantastic little girl that I ever could have imagined. I'm sure it is hard for parents to accept a diagnosis of ASD, but support from family, friends, teachers, healthcare workers, and on, this will make a difference for that student with ASD.